Health Educator Mike. Alright, so I welcome you all for today's live streaming. Um, this is Hardy Living Global, as you all know, and I'm Health Educator Mike, the health educator of this live streaming channel. Alright, so we will be working hand in hand with both the healthcare practitioners and healthcare consumers. Let's see how we can promote our health in general. That's what we do in this particular channel. So if you have been following this particular channel for some time, so if you have been a devoted member of this channel, you are going to see a lot of things we are doing on this channel. Right, a lot of videos we have created on this channel, a lot of live streaming and informations we have shared on this channel, which if you listen to them or watch them carefully, you are going to understand that it's something that will improve your health. So definitely it's going to improve your health. So, and it will make you to stay on the right path instead of believing in unnecessary myths. All right, so it will make you to stay on the right path, so that you live a healthier life. Right, so if you are joining us for the first time, do well to share this video or share the link of this live streaming to groups where you belong to, um, and also subscribe to our channel and turn on your notification. We stream every day actually, by 10 a.m. Right, on Sunday is between 12 to 3 p.m. So we can decide it and streaming between due to the activities of that of Sunday. All right, so but every um every day we stream by 10 a.m. So I invite you all, if you are watching us for the first time, just make sure you are part of us. Every day by 10 a.m. we stream, all right, and sometimes can start a little bit late, right? So, but all the same, what we are still working hand in hand is to make sure that we promote our health in general. So that's what we do. Now, in today's topic, we are discussing about cystoid infections, right? Cystoid infections, the silent invaders. Cystoid infections, the silent invaders. Of course, if you are hearing of cystoid infection, you can say, what is cystoid infection? Sometimes we interchange it with other parasitic infections, right? We have a lot of them. We have nematode, right, like that of tapeworm, roundworm, and so on. Right, we have different type of parasitic infections, right? But today we are just going to discuss about cystoid infection alone. All right, so what is this cystoid infection? It can also be called tapeworm, right? What are they? What are they capable of doing? Of course, if you did elementary aspect of biology and maybe integrated science, all right, you are going to see a lot of discussions on parasite, right? What are parasite? We have ectoparasite, we have endoparasite, right? So this one we're talking about the endoparasite, right? Because most of them lives in the worm, lives in the intestine, right, or gastrointestinal area, and some of them live even in some organ like the brain, the liver, and so on, even under the skin. So that is what happens there. So um, there's different type of these parasitic infections. All right, there are different type of parasitic infection, but the major thing is this: let us be getting them one after the other, what they are capable of doing and what they can cause in the body. So today we just picked what cystoid infection, all right, as one of the parasitic infection we are going to discuss. Now, what is this cystoid infection? Cystoid infection, we say that what they are flat in structure, all right. When it comes to their structure, they are flat and they are like ribbon shape, all right, that you can find in the intestinal wall, all right, and sometimes in some organs in the body. All right, so they are parasites, and of course, any parasite is something that deprives someone of nutrient. All right, it deprives someone of nutrient without contributing anything to the person. We can say that is a nuisance. So, because it has nothing to give. All right, parasite don't give anything to the body. Rather, it will take something from the body and also cause disease. So, now he said that what is their leaves in the intestine that they have what ribbon shape, flat ribbon shape, like structure, all right, and they live what in the intestine and even in other organs of the body. And we're going to mention them like the brain, the liver, the lungs, and so on. We're going to mention the areas where you can find them and what they are capable of causing. So all those things are very necessary. All right, so now having established that this tapeworm, all right, or which is a cystoid infection, is a parasitic infection. Now let us now discuss what ways can we contract this parasitic infection. How do we now get this parasitic infection? Because you cannot just stay and a parasite will come, right? So something must bring it into the body, of which we need to know exactly what will bring it into the body. And before we even continue, I want to let you know that it's capable of causing a lot of things in the body, like anemia or anything of which you can think of. It can cause a lot of things in the body, all right. Um, but we're going to follow it one after the other. Let us just establish um one the ways by which we can be able to contract it. Now, number one is that we can contract it from undercooked meat, all right, like pork meat. We can contract it from there. Even beef, we can contract it from the undercooked, all right. For people that will say, okay, let me parboil this particular meat, make sure you cook your meat properly, because all those ones have some lava um worms or lava tapeworms in them, of which if you did not cook it as expected, it's not going to destroy that young growing tapeworm, right? And when you take it in, it will enter into the intestine, and before you know, it will now begin to disturb you and give you different signs and symptoms, of which we are still going to come to those signs and symptoms that this tapeworm can give. Now, I say that what undercooked meat, all right, can cause it. Number two, or can make someone to get this tapeworm. Number two is undercooked food. Yeah, if you are not cooking your food enough, all right, or maybe like people that go on vegetables, maybe parboiled vegetable or even fresh vegetables, they will go and be consuming it. Is have a lot of um, nutritional need, all right, have a lot of nutrient, all right. Many um, nutritionists are prescribing it for you. Okay, this is what I'm going to do. Take this vegetable, take the other vegetable, have this vitamin, have protein, have this. Of course, it's possible that they may have it, but have it at the back of your mind that if you are taking all those things as prescribed in that way, a lot of vegetables undercooked or the one that is not even cooked at all, make sure that what you have your way of deworming yourself of this cystoid infection, because they can come from all those vegetables you are taking. So undercooked food can cause um this tapeworm, all right. They can cause this cystoid infection or bring it into the body. Now the next thing is what? Poor hygiene. Yeah, some people discover that if they are done going to toilet, all right, to pass feces, they will come back, all right, without washing their hands, or some people will start eating without washing their hands properly. That's one thing is to wash your hands, and another thing is to wash your hand properly. All right. So now, if you're able to wash your hand properly, you are going to remove a lot of microscopic um, um, worms or even bacterial infection and even other of which you may likely contract if you didn't wash your hands. So it's recommended that you maintain a good hygiene, all right, to make sure that what you get rid of all those things after you are done going to toilet and even before eating. All right, so poor hygiene is one of the cause, and that thing also is contamination of the food or drinking water by dog feces. All right, feces can pass some dog can pass some feces which may contaminate the food you are eating or even the water you are drinking, which at the end can bring about this cystode infection, because they develop a lot in dogs. All right, they flourish in the intestine or in the intestine of dogs. All right, that's the reason sometimes you need to deworm dogs. If you don't know and you have dogs at home, it's actually important. One of the problems that they may having, which can make them to be diseased, is what? Worms. All right, so they have a lot of these cystode infection in their intestine. So when they excrete, they are going to, and it get contaminated or get into the food you are taking or the water you are drinking, of course is going to make you to develop this or have this cystode infection in your intestine, and before you know, it will begin to trouble you. Now, having established the the ways by which you can contract this, all right, the way by which we can be able to get this, or this can enter into our body and begin to grow. Now, the next thing we are going to discuss is the types of this cystode infection. Of course, we say that cystode infection is same as tapeworm, aka tapeworm. Now, what are the possible ways possible types of this cystode infection? Now, number one is beef tapeworm. Beef tapeworm, all right, like all this cow meat, all right, and so on, all those kind of meat, all right, from cow. So they are one of the example, all right, from beef. So now, tapeworm that is gotten from beef, which is to say they are gotten from what? Undercooked beef. All right, so beef tapeworm, which we also call Taenia saginata. Taenia saginata. All right, so they are gotten from what? Undercooked beef and other meat that is under that class. That is cow meat and the rest. So if it is undercooked, all right, you can get this tapeworm, all right, from them, and once it enters into the body, um it will begin to develop, and before you know it, a lot of things will be happening. It can cause you gastrointestinal upset, it can cause you a lot of pains, it can make you to vomit, it can cause anemia, cause a lot of things. All right, so we are still going to mention the symptoms, the signs, and so on, the complications. So I would say that what number one of it is what this beef tapeworm, all right, which you say is what? Taenia saginata, and of course it gotten from what? Undercooked beef, all right. So and then live what? In the intestine. That is number one. Number two is what? Pork tapeworm, the one gotten from pork, like pig meat, all right. Those ones used to have it enough, all right, in their intestine and even in their body. So now, if you get the one from that pork, all right, so we call that one Taenia solium, Taenia solium, or Taenia solium. Anyone you may try to pronounce it, which is different from Taenia of ringworm. All right, so which is fungal infection. So that one is a different thing, right? So, but this Taenia solium. So you say that what you gotten from pork, all right, pork um pig meat and so on. If it is undercooked, please do not take them, all right. Taking them is just risking your health, because when you contract this cestoid infection, sometimes it may be silent. You may not even notice any symptoms, all right. You may not notice any signs, and it will be eating you up gradually and capable of causing anemia. You may not know. We are going to get there to make it clearer to you. Now, this particular one, which you can get from the pork, all right, from pork meat. We say that what you can get it from the eggs of pork meat. That is, the eggs can be on the pork meat and so on, right? And before you know, which is the larval stage, it will enter into the body and begin to develop and enter. It can be on the intestine, and some can travel to the brain. If you're wondering how come, that is it. Some of the cestoid infection, which is tapeworm, can travel as far as going to the brain. And when it gets to the brain, it causes a lot of issues. Can cause seizure. It can cause other damage to the brain. You can be, I say, this person, I've checked this, my child is not having any issue, is not having any mental issue, but having seizure. What is the issue? Begin to wonder. It's village people. You may not even know it's just common cestoid infection, right? One side that is causing this. So we need to learn. We need to learn. Now, it can be in the intestine, which this one we say is Taenia solium, all right, the one gotten from pork. It can be in the intestine or even in the brain, which is number 2. Now, number 3 we are going to mention is fish tapeworm. Fish tapeworm, we call it D. latum. All right, is another name for D. latum, and is from what? Undercooked fish. Undercooked what? Fish. That's where this one can be gotten from. I wonder the person that will be cooking fish and you make it to be undercooked, or maybe, or less people that are roasting, you understand. So you must roast it properly to make sure that what you destroy this tapeworm. Very, very important. So that is where we can get this particular D. latum. Now, and what is it capable of causing? This particular one is capable of causing vitamin B12 deficiency and also anemia. Vitamin B12 deficiency and also anemia, all right, which we call pernicious anemia. That is vitamin B12 deficiency, pernicious anemia, and also capable of causing anemia like iron deficiency anemia. All right, so please take note of that. And once it gets into the intestine, that is when it begin to act and do all those things. Now, the next one we're going to mention is dog tapeworm. Dog tapeworm. All right, dog tapeworm. Where can we get this from? From the can be from undercooked dog or from the feces of dogs, right? Contaminating the water and the food that we're taking. For those that are taking care of pets, you understand, you need to be very careful, right? A lot of diseases can be contracted from all those animals, all right, which can be dangerous to your health. So you need to um, make sure you act in the right direction to prevent all those diseases that can be contracted. So that of dog, all right, which we can contract from the contaminate when their feces contaminate food or water that we are drinking. All right, that one is capable of causing problem in the liver, in the lungs, all right, causing cysts, all right, causing a growth in the liver, in the lungs, and other organs, and it can be painful. All right, and you say, what is the issue? It's just what? Tapeworm. All right, tapeworm gotten from what? Um, food or water contaminated by the feces of dogs. Now, the last one we're going to mention on this type is what? Dwarf tapeworm. Dwarf tapeworm. Now, that one can be, we call that one H. nana, right? H. nana. Now, it can be from person to person, right? And it can also be from food. For instance, in a place where they do not do a proper sewage disposal, right? You know, they will dig a soak away here, and there is a well down there, all right, which the well is not so deep, all right, which some there may be leakage from the soak away into the well is a problem, all right. So all those things are a problem. There can be contamination. All right, so contaminated water, contaminated food, person to person, that is how those ones are transmitted, and they can be very dangerous. They can cause a lot of things. They are very common in children, all right, but even adult also can get it. Dwarf tapeworm, all right, which we call H. nana. All right, now we have mentioned the types of this tapeworm, all right, of which, if you are to summarize all, we say that most of them can be from undercooked food, can be from undercooked meat, all right. It can be due to what hygiene issues, all right, poor hygiene, which we have mentioned this before, all right. So just for you to take note. Now, let's not mention the symptoms, all right? Because sometimes we may not know the symptoms, and most of us, especially in a country like Nigeria, before you can seek medical help is when you're having signs and symptoms. If you are not having signs and symptoms, if you are not having signs and symptoms, I don't think someone will, like in Nigeria, I didn't see other countries, like in Nigeria, it's very difficult for someone to stand up and say, I want to run one or two tests. Unless the person having any symptom or signs of something. All right, so which is a problem, and due to our economy, that is where the issue is coming from. All right, so if you have not eaten a good 3 square meals and you want to use the little money you have to go and run general tests, all right, and of course, that test that we would have spent our money to run would have saved us a lot of money, but it's a misconception. All right, so all of us need to be encouraged. We need encouragement. Even as I am, I need encouragement. All right, for me to be able to go and run some tests that are necessary, even though I'm not having any health challenge, of which I've been mentioning before now, that if you want to claim that you are healthy or beat your chest that you are healthy, which is that what you have gone for thorough checkups, you have done a lot of checkups and discovered that you don't have any ailment, you don't have any illness, you don't have any issue in your system, which is what can give you a guarantee that you are healthy. But for the fact that you can move around without slumping or anything, doesn't mean you are healthy. And of course, from the scholars' contribution about health, it's from every evidence, no one can be totally healthy, right? You can just be on the path of well-being, but you cannot be totally healthy. So we keep updating, we keep making effort, we keep working hand in hand with the healthcare providers, healthcare consumers. Let us see how we can improve our health on daily basis. It's an active, you see, health, pursuing of health is an active um effort, right? It's not something you need to relax. It doesn't have a holiday, all right? To have done maintain your hygiene today, tomorrow you want to rest. It doesn't need any rest. You did exercise today, your body become physically active. So tomorrow you say you are no longer doing exercise, or for the next 3 months you are no longer doing exercise because you have done before so that you rest. I tell you, at that time, the body will send you a bill that you are going to pay. All right, so to keep up, you need to start the one that you can be able to do and be consistent. Consistency matters when it comes to health, all right, in general. Now, back to what we have been discussing before now, we say that what, let us mention what the symptoms, the signs and symptoms, so that we know what is happening. All right. So for those that have symptoms similar to this, you can say, okay, let me run some tests, let me know what is happening. All right. That will help us to be able to track this issue and get it solved once and for all, instead of allowing it to become a challenge in the system. Now, number one of the symptom, let me even state it before we begin to mention that one. Number one is that what it may not give you any symptoms, any signs. That is number one. Asymptomatic or asymptomatic, anyhow you want to pronounce it. All right, so sometimes it can become what asymptomatic. Now, another thing, another symptom is that what it can give you abdominal pain. That one is very common. I'm having abdominal pain. I want to warm myself. I want to do begin to buy one medicine parental, even albendazole. You begin to buy praziquantel. You begin to buy, not knowing exactly the right one that you're expected to do. You need to seek medical help, right? Because all one medicines are not the same, and they have specific worms that they treat, right? Even though some can be very broad in activity, right, like that of albendazole, but still you need to seek medical help so that you get some certain directions or right prescriptions for your cystine infection. Now, say that what number one, it can be symptomatic. Number two, it can give you abdominal pain. Number three is that what it can result to diarrhea, right? It can cause what? Diarrhea. You'll be wondering what is happening, not knowing that what is cystoid infection. It can also cause weight loss, right? As one of the symptoms, it can give you what? Weight loss. You begin to wonder what is happening. You don't know that what they are there causing some things underground, eating you up, drying your blood, not knowing. At the end of the day, you develop anemia and you lose weight. Weight loss is one of the sign and symptom of this cystoid infection. Now, another thing is what? Increased appetite. You'll be eating. You'll be eating, all right, which is one of the common ideas in Nigeria. When someone overeats, when you do the warm yourself last, sometimes you may not be a result of this cystoid infection. It may not be a result of any worm, all right. Just seek medical help or know exactly what is happening. Of course, if you are having hyperthyroidism, all right, hyperthyroid, which can lead to over metabolic process, all right, can the rate of catabolism become greater than that of anabolism. You are going to have a lot of appetite, increased appetite. Of course, it's not cystoid infection. Seek medical help, seek medical help, seek medical help. So that is it. Increased appetite is one of the signs that we are going to notice when it comes to this cystoid infection. Another thing again is seizure. People can notice it, just like I see that some can travel to the brain, all right, like that of um lot of tinier solium, all right, can travel to the brain, all right, and cause issues in the brain or develop cyst in the brain, which can result to seizure. Someone can be having seizure, be checking, you think maybe it's epilepsy, or you're having one brain damage or something, all right, not knowing that what is just a cystoid infection, just tapeworm that is disturbing you. All right, so please take note of that, which is the reason tests are very necessary. Now, another thing is what? Swollen. You can notice swollen under the skin. All right, you can notice swollen under the skin. You can notice swollen um cysts on the liver, even on the lungs. All right, so all those things are the signs that you can notice, and before you can be able to see all those ones, you may need what? CT scan. You may need ultrasound, right, so that it will view all those systems. You begin to see all those worm embedded in that organ. So that is just what I expected to do. So all those things are the sign that is going to give you that you say, this one, it may be cystoid infection. I didn't mention this, sorry. We have nausea, right? You feel like vomiting, and sometimes it can even result to vomiting. Begin to think, and what is happening? How do I solve this? And so on. So all those things are the necessary things that you're expected to know about the symptoms of this cystoid infection, which is tapeworm. All right. So when you know the symptoms, you can be able to tell when you're having this cystoid infection, then know how you're going to seek medical help. And sometimes you have your money, you can just tell them, go to the health center and say, okay, I want to run the test and know what is happening to my system. There's a lot of tests that you need to do. All right. So by you standing up, waking up, moving around doesn't mean you're completely healthy. So what can show that you're healthy is what? That your head status after you're done um running one or two tests. Now, having discussed about this the signs and symptoms that are going to feel all right when you're having cyst infection or tapeworm, the next thing we're going to discuss is what? The diagnosis. How do we diagnose this? All right, of course, um one of the things that you should know is even from the symptoms, it is directing you, okay, that it may be cystoid infection, it may be this tapeworm. But now to a kind of clear your curiosity or even make you to understand better of what is happening to you, so you can proceed and go for diagnosis. Number one, you can do stool culture. All right, do stool culture. So culture can help and know if the eggs of those tapeworm are in your stool. So all those things will help you. And once you are able to know that, then you can proceed for treatment or using like some antiparasitic medicines to destroy them. All right. So you can do what? Stool culture, and that thing you can still use blood. Right. Let them know if there is antibodies of this tapeworm in your blood. If there's antibodies, of course, once they get into the system, they will now develop, they'll release an antibody. So if there's an antibody of this tapeworm in your blood, when they do blood test, they will now start treatment of that cystoid or tapeworm on you. So they can do blood culture, all right, and they can also do um this stool culture, right, to know what is happening to you, if you're having any symptom, or even if you wish to just check now, right, so you can be able to get it clearer. Now, another way of diagnosing it again is CT scan and ultrasound. Of course, like the one we have mentioned, that it's capable of causing cysts in the liver, in the lungs, all right, in the brain. You cannot know that one by just doing stool culture, right? You cannot see that in the stool. So, which is to say that if you use CT scan or ultrasound, it will show you if those worms is embedded in the brain or is somewhere causing cyst in the liver or somewhere causing cyst in the lungs. When you're able to get all those things, then you can be able to kickstart treatment at once. And sometimes it may need different treatment procedures. Some may need a very sophisticated surgical procedure, right? Which you need to just make some decisions, right, with your healthcare provider, then know what exactly you're expected to do. If it's a very serious one, you're having a cystoid infection that have formed cyst in your brain, you are using albendazole. Albendazole can destroy some cystoid infection, but cannot remove that cyst that have been formed in the brain. So, which is to say that surgical procedure can be done so that they will remove the cyst that is on the brain. All right, so that is it. Cystoid infection is something that we take for granted, but it can be serious. It can be serious and can be dangerous. All right. Now, having discussed the diagnosis, right? How can we to diagnose it? The next thing we're going to go for is what? The treatment. How do we treat cystoid infection? Number one treatment is what? The use of what? Antiparasitic drugs like praziquantel, albendazole, and other antiparasitic agents. But before you take anyone, please discuss with your healthcare provider, right? Discuss with your healthcare provider so that they can be able to guide you on what to do, especially if you have gotten a very comprehensive diagnosis of what is happening to you. Work hand in hand with your healthcare provider so that they will decipher a solution, right, or profile a solution that will be best for your treatment instead of you doing a self medication or anything of such. it's going to be a problem to you. So we say that what use of what antiparasitic agents is first treatment pattern you call one of the ways by which you can approach the treatment procedure. Now, another thing is what use of vitamin B12. Of course, we mentioned that there is some that will deprive someone of vitamin B12 and even cause anemia, all right, which is the one gotten from pork. So now it can it to all right. Sorry, we're right back. Now, so for that of a treatment, right? The next one is what surgical procedure. Yeah, if you use surgical procedure, definitely, um, it can remove that of the one that caused cyst in the lung, cyst in the liver, and even that of brain. So surgical procedure can handle that perfectly and get it resolved. Now, the next thing we're going to go for, all right, of course, there's other treatment method, but we need to discuss that with your healthcare provider and get the right one that will be okay for you. Now, prevention. Prevention. How do we prevent this cyst infection? Number one, make sure that what you cook your meat and your food properly before taking them. Properly before taking them. Cook your food and your meat properly before taking them. Take note. Most of them can have eggs of this tapeworm, of which if you are taking them, it can cause harm to your health. Take note. Another thing is what, which is number two, wash your hand properly once you are done going to toilet and even before you eat. If you are just coming out from the toilet, wash your hand properly. All right. If possible, you can use antiseptic or good soap. Wash your hand properly with warm water or any water. Just make sure that you wash your hand properly before food or after you are done going to toilet or passing out feces. Wash your hand properly. Now the next thing, which is number three, is what safe water. Make sure that what your water is safe for drinking. If it's not safe or you are not sure of your safety of your water, boil it, all right, allow it to cool and take. Boil it, allow it to cool and take. It's going to go a long way in helping you to prevent them because you don't know the one that is contaminated. You are seeing a borehole, you want to drink water from borehole. What if this there is a leakage of soak away around into the borehole? So you don't just drink it like that. Boil it to kill some of all those microorganisms, then you can be able to drink them. So safe water and even safe food will help. Now we are remember I say on what prevention. Now the next one is what proper sewage disposal. All right, proper sewage disposal anywhere around the environment. Dispose your waste, all right, properly. When you are expected or where you are expected to keep leather, you keep it there. Where you are expected to keep um garbage, all right, you keep it there. When you are expected to keep so many things, just keep them the right way and also have um a good like water closet sewage system, all right, that will be okay to push the feces and also make sure it cleanses, makes everything to be okay and normal instead of the thing leaking out to contaminate the water body. All right, so make sure that what you maintain one good sewage disposal. All right, good sewage disposal will help. And also, number five, deworm yourself. Right? Make sure that what you deworm yourself from time to time, and also deworm your pets from time to time. Right? Deworm yourself and also deworm your pets from time to time. If you have dog at home, deworm them. All right, at interval. It will go a long way in helping you to prevent them. All right, because if they contaminate your food and they don't have the worm, of course you have succeeded in preventing this cestoid infection. Now, the last thing we're going to mention is what? Avoid raw vegetables. Raw vegetable, they tell you, this one, this green beans, put it direct, it will be more better for you. This green leaf, this different things, right? Different vegetables, okra and so on. Put it direct. That this one will be okay, right? That if you're eating this, it will just give you the need that you must have an antiparasitic medicine. If not, you need to. It will be a challenge to you, right? It can be a challenge to you if you don't have what an antiparasitic little distractions is called that are coming in. All right, so please, guys, we are going to stop here for today. I believe we have discussed extensively on this cestoid infection, which is tapeworm. All right, tapeworm can be dangerous. It can cause a lot of things in the body. Please take note of this. Prevent them as much as you can. Watch this video properly. If you didn't get the full gist, watch it again. Share it to friends and loved ones. All right. Make sure people see this video. And if you have further question, put it on the comment section. I'm going to attend to it. And just know that what I'm able or ready to defend what I've said here about this cestoid infection. So I'm always ready to attend to you guys. I remain Health Educator Mike, a health educator of this live streaming channel. Stay tuned for other interesting health tips or topics that I'm going to discuss here. And I believe we all will move to the permanent side. So thank you very much all for being part of us. I remain Health Educator. See you tomorrow by 10 a.m. God's willing. Bye.